G'day, I'm Martin Laverty, coming to you in this last week of the federal election campaign. Down behind me is Parliament House, and on Saturday night you'll know who's going to be sitting in the Prime Minister's chair in that building. Over the course of the last 5 weeks, health and aged care policy hasn't been front and centre. We didn't expect that it ever would be. But there are three things that we think the next government, whoever that government is, should consider in relation to the health and aged care portfolios. The first item is that we recognise the budget deficit is going to be a priority for the next government. We know that government is going to be looking for savings in expenditure right across government services, and it will certainly be looking for efficiencies within the health and ageing portfolio. We're saying to the next government, whoever it is, before they make any decisions to cut health and aged care spending, they should be consulting with those that provide health and aged care services. They should be consulting with those consumers of health and aged care services so that we might find efficiencies together in partnership instead of having government do things to the health and aged care sector. The second priority that has actually come up during the election campaign is a commitment of both sides of politics to work on the reduction of red tape. The health and aged care organisations around Australia are some of the most highly regulated organisations you're likely to find. The opportunity to reduce red tape, to cut the regulatory burden, particularly in our hospitals and our aged care services, is welcome. And again, we want to consult with whoever forms government on Saturday night to ensure that we are able to take some of the pressure off running our hospital and aged care systems. Finally, we have seen in recent years an interest of the Federal Treasury in taking a new look at tax concessions of not-for-profit organisations. Not-for-profit organisations play a very important part in delivering services right across the Australian community. As the government is looking to balance its budget, it would be very tempting to alter not-for-profit tax concessions. Once again, we're saying any decision should be made after consultation. Government should be very careful about how it goes about making decisions in relation to the not-for-profit sector. And we'd like to think that genuine and ongoing consultation can be a hallmark of whoever forms government on Saturday night. Over the course of the last 5 weeks, health and ageing hasn't been front and centre. We hope when government is formed in the coming days that maybe we can get back to prioritising those things that are important to all Australians.